sake of time. So good morning, everyone, again. Welcome to today's presentation. We have with us today Dr. Heidi Torres. She is an attending physician of infectious diseases, an assistant hospital epidemiologist at NewYork-Presbyterian Weill Cornell Medical School. And today she is going to be talking about the flu, what you need to know, and just updates about that. So whenever you're ready to take the floor, Heidi, just take it away. And thank you so much again for being here.
Sure, thank you. I'm going to start sharing my screen. Let's do this one. All right. Are you guys able to see the PowerPoint in the presentation mode?
I think I see the presenter mode, so I see your screen,
Yeah. Okay. Does that look okay now?
Yeah, perfect.
Got it. Okay. Alrighty, so everybody, I'm going to be talking about the flu today. This presentation should be a little bit shorter than last time. We're just going to touch on some higher points, commonly asked questions, things like that. So the way I like to design these talks is to ask questions to kind of direct the flow and then answer those questions in each slide. I like to think of the questions I would like to know if I was in medicine, or even questions I forget when I'm in medicine, and just answer those and try to cover the most commonly asked questions. And then we can use the last 10 or 15 minutes or so to see if there's any other questions. So let's start off with the most basic thing. What is the flu? So many of you know this, but for a recap. So the flu comes from the influenza virus. This is a respiratory virus. This is similar to COVID in that it is also another respiratory virus. On the right-hand side, you can see these two pictures of the viruses. So this is the one that causes the flu. This is the one that causes COVID. So you can see they have their capsules and all these little proteins on top, or antigens, that give it a lot of characteristics, properties, infectious nature, things like that. This is a virus that's similar to COVID, infects the nose, it infects the throat, and sometimes it can infect the lung as well. That's where we are usually infected from the environment, and that's where the virus can replicate. And that's how we can, or where we can also shed virus into the environment and to others. So there's a few different types of influenza viruses, and within a few of those types, it breaks down to even more types. The main categories that we worry about for the seasonal flu are type A and type B. And type A, specifically influenza A, is the one that can cause the most drastic pandemics that we frequently see with lots of spread. So I think a lot of people, including myself, before I saw it firsthand, really thought of the flu as just a common cold. The common cold is due oftentimes to viruses like rhinovirus, to adenovirus, things like that. And they still can be pretty significant, but they're much wimpier viruses in terms of severity. We don't have people that are dying of the common cold, while the flu is much more severe. It causes a lot of complications and does have a much higher mortality rate. So the flu season is all the way from October until May. A lot of us, including myself sometimes, will really think of those peak moments in November, December, and sometimes January, which is true. That is where we see the bulk of the flu. But you can see cases of flu start to spread as early as fall, and I've seen them as late spring, almost summer. So it's a pretty long season. So the flu causes the typical upper respiratory symptoms. So you're going to have your cough, your sore throat, your chills. It goes a little further past the usual common cold. So this time it's going to cause a lot of body aches. You should feel fatigue. Headache is also common with the flu. And fever. Though not everybody is going to have all of these symptoms, you can still have the flu and only have a handful. You usually are going to feel much, much worse. And sometimes kids can have GI symptoms, so they can have some vomiting and diarrhea, specifically if there's a different type of flu strain that can cause this. But those are oftentimes seen a little bit more in kids. So we're going to compare some of the symptoms in a second between common colds and flu. They overlap a lot, and they even overlap more with COVID. So it's really hard to tease out. But in general, the flu is going to make you feel a lot sicker than a regular cold. So why do we care about this? Why do we spend the time to give this presentation and talk to people about the flu and give them lectures and blah, blah, blah? Why do we do that? There's two main reasons. One, it's dangerous. And two, our cases are just skyrocketing right now in the flu much more than prior years. So that's the main reason that we want to give a talk like this and spread a lot of information. Even though we're already halfway through the season, our numbers are still going up dramatically. So many of you may know about the 1918 flu pandemic and even had family members who died during this pandemic or lived through it. So this was a severe influenza pandemic that is one of the most deadly recorded events in human history. So this pandemic, it killed about 50 to 100 million people across the globe. And it killed more people than the Black Death in Europe or the bubonic plague. It killed more people than any other war, AIDS, you name it. It was very, very severe, it's very dramatic, and it was basically like our past COVID. This was a little over 100 years ago. Pandemics are a part of human history, they're a part of nature, they're going to happen again in the future and again and forever. As we as people grow and evolve, so do viruses, so do bacteria. So it's easy to forget when there's large lapses of time between each of these major events. So now we have COVID, but 100 years ago, this was what a lot of our streets look like, a lot of our hospitals look like. And this is a photo from that same time period that looks very similar to today. Mask use was very controversial, but it was being used. We were talking a lot about the spread of disease and things like that. Over time, we do forget about these things, and with COVID, we remember, but this is a part of human history, and flu can do this. It doesn't have to be a new virus. It just has to be a virus that we're familiar with that changes in a way that makes it more dangerous. So that's one of the reasons we care about it. Looking back a little bit about how many cases we've seen, the CDC and the World Health Organization tracks a lot of this information very closely. So throughout the years, you can see the trends of what flu has done, how deadly is it, etc. So you can see here, this is a list or a chart of each of the years. So you have 2017 to 2018, 2018, 2019, so on and so forth. You have your cases of symptomatic flu. So these are estimates. So there's a range, but roughly these are decent estimates. They can underestimate it as well as overestimate it sometimes. Hospital visits and deaths, I thought were really the key things to pull out from these data. So in 2017 to 2018, for example, we'll take this one since it was one of the more deadly ones. There was about 41 million worldwide cases. I'm sorry, US cases. This is US data. 41 million US cases of symptomatic flu. Close to 1 million hospitalizations and about 50,000 deaths here in the US. So that was a particularly deadly year. And it was one of the more deadly years in the recent decades. So recently it's been a little closer to 20,000 deaths and still 20 to 30 million cases. So in 2020 to 2021, of course, this is when our COVID pandemic hit, there was actually no data because there were so few cases. And in the next graph, I'll show you how low cases were, but because of all the changes we made for COVID, social distancing, staying home, washing our hands, wearing masks, our numbers plummeted. The same things that prevent COVID, prevent flu, prevent the common cold, and so on and so forth. They're very similar in how they transmit and how they infect other people and how they behave. So everything we've learned in COVID, it still applies to the flu. And then in 2021 to 2022, this is still preliminary data from last year. But again, there was a lot lower cases because a lot of these COVID things we did are still in effect. So what's going on right now? So this is a graph of the New York State Department of Health. And you can see that in prior years, so here we have 2022, 2023, this is our current season, which again isn't even over. You can see how these cases are just going basically straight up. Well, in other years, 2021, 2022, last year, a lot lower. But again, COVID pandemic, let's look at a year that was before the pandemic. And that's this blue line, 2019 to 2020. So just before really the flu season was ending, just when COVID started kicking off in the US. So this is what usually it looks like. And we're very different, right? Or we're in a very different place. And then if you look very, very hard, you can see this purple line, which is this basically flat line of flu cases during the COVID, the prime year of 2020. So again, barely anything, barely any data. Now, it's not realistic, it's not sustainable to stay in your house forever, to never go outside, to social distance. It's not realistic, and I think we're all pretty tired of it. But there has to be a balance in what we can do and what we should do to stay protected. And some of those things include vaccination, which we'll talk about. So far in the season, from October through December 3rd, the CDC has estimated there's already been around 13 to 27 million flu cases, 6 to 13 million medical visits related to the flu, close to 250,000 flu hospitalizations, and anywhere from around 7 to 21,000 flu deaths. So that's pretty high. You can see that those numbers of deaths are already higher than our last year, for example, at the end of the season. So we're in a very different place than we were last year. So why are our cases going up dramatically in past years? Just as we saw with other flu strains, they can behave differently. They can be more infectious. They can spread. Now with the precautions in COVID coming down, a lot of people are traveling a lot more for the first time. Our immune systems are a little bit different. So it's usually due to a lot of things. So how does the flu spread? It spreads the same way as COVID. It spreads from droplets, from coughing, from sneezing, from talking. Rarely, I know we worry about this a lot, but it's rare to get viral infections from surfaces. Viruses usually don't live for very long, and you would have to pick up enough of the virus in your hand, and then within a specific short window of time, touch your eyes, touch your nose, touch your mouth, something like that. So it's a lot more rare. The main way viruses are spread is through the air. And you don't even have to be coughing. You don't even have to be sneezing. The act of talking alone is enough to spread a decent amount of droplets. So if you're infected, even if you don't have symptoms, you can be spreading droplets significantly. And it depends how contagious it is. How much virus do you have in your body? Are you early in the flu? Are you late in the flu? Did you have infection that reached your lungs? How long were you talking to someone? How close were you? Did you have a mask on? Did they have a mask on? All those things change how infectious someone can be, but it's spread the same way. It is not airborne in the sense that it does not linger in the air like tuberculosis, where the particles are so small they can really stay in the air and cause infection for a long time. The flu is not airborne in that sense. It can be temporarily airborne as you cough it out, stays in the air a little bit, but it dissipates. So how contagious is the flu? So we talked about this already a little on the last slide, but you can't spread the flu if you don't have symptoms. So we usually say around 24 to 48 hours before your symptoms start, with the bulk of it being around that 24-hour period. So some people can have no symptoms the entire time, similar to COVID. They can just be asymptomatic. And then some people can have symptoms, and you can be infectious in both those scenarios before the onset of symptoms. So it's about a day or two before. So for example, if someone calls you and say, hey, I tested positive for the flu, and you're with them all day yesterday, there's a potential, and you had close contact and you guys shared drinks or were in the same room for a long period of time, or they had a cough, there's a good chance that you may have been exposed. So you're also infectious from the time of symptoms start to about 5 to 7 days afterwards as well. Having fever is a big part of it though. So once your fever comes down, your infectiousness also improves. The most contagious days are about 3 to 4 days after your symptoms start on average. So that's when the virus is a lot higher in your body. So what can I do to prevent the flu? So again, same things as COVID. Avoid crowds if you can, and wear a mask. Consider wearing a mask. Sanitize your hands. Avoid close contact with anyone you know who's sick. You know, that's not always avoidable if you have a loved one, if you're taking care of children, an elderly parent, etc. But if you have a friend and they have a cough, maybe you can have drinks with them when they're a little bit better. And then get the flu vaccine, which is probably the biggest thing we can do. So what if I'm exposed to someone with the flu? So that example that we just gave, my friend, has the flu now, and then I was with them yesterday or the day before. So the best thing you can do is get vaccinated if you're not vaccinated already. So even if you were exposed to that person, the vaccine honestly is going to kick in fast enough to protect you from that exposure, but chances are you are going to be exposed again. If you haven't been vaccinated already, that's the most important thing you can do. After that, or at the same time, monitor for symptoms, and if you have any symptoms, have a low threshold to get tested. Getting tested is important because you may be a candidate. First of all, you want to know if you have something that's a simple common cold, or if you're going to be infectious with something a little bit more serious. And then you can also be a candidate for antivirals. So anyone who's at high risk of complications, which we'll run through all those categories, they can be eligible for an antiviral. Usually we use Tamiflu to prevent illness. So this is if you do not have the flu, but you're exposed to someone who had the flu and you have a high risk. Say, for example, you have cancer and you're on chemotherapy, or you have heart disease, you may be a candidate to get antivirals or Tamiflu to prevent getting illness. That should really happen though only within 48 hours. So if you saw your friend the day before they were testing positive for the flu, and then your friend called you 5 days later and say, hey, I tested positive for the flu, you're really out of that 48-hour window. So it's not expected that that Tamiflu is going to protect you anymore. And what we worry most about is that even if someone gives you Tamiflu, if you've already been infected, the antiviral won't prevent it, but what we'll be doing is treating the virus halfway. So the Tamiflu to prevent infection is at a much lower dose than the Tamiflu to treat. So if you're past that 48-hour window and someone still gives you Tamiflu, you may already be infected. I'm not going to prevent it anymore, but I will undertreat you. So that's why we really just say 48 hours in most cases. So high-risk conditions really include anything that's going to affect your immune system, affect your lungs, affect your heart. So asthma, any other lung disease, any blood disorders, endocrine disorders like diabetes. Diabetics are at higher risk for complications. Heart disease, so if you've had, say open heart surgeries or lots of stents in your heart, liver, kidney, neurological conditions, and then the most logical things. So if you're on chemotherapy, if you have HIV, if you have a transplant. Other high-risk groups include older adults, so 65 and older, and then young children. So under the age of 5, specifically infants under the age of 2 are very, very at risk, and children die every single year from something as common as flu. Pregnant patients are also a high-risk group. So vaccination is really encouraged with them. There's a lot more fear around pregnant patients because they're worried about they may affect, the baby or the development of the fetus. But on the contrary, the babies are born with about 6 months of antibodies and protection when that happens. So we really encourage it. And even up to a few weeks after delivering, you're still at risk because your body's gone through so many changes. So we definitely recommend it. And then a few minority groups and anyone who's living in a nursing home, because you're in such a close quarters with everyone, you may be exposed a lot more easily. So those are the high-risk groups. We're going to mention this group again, but just to recap, this is definitely anyone who should definitely get a vaccine. But if you're exposed to someone, you may also qualify for prevention with antivirals. So how do I know if I have the flu? And again, it's not easy. A lot of these things look very similar. But in general, like we said, the flu is much more severe and it can look a lot like COVID. So with a regular common cold that you can get any time of year, you're really going to have symptoms that kind of stick from, I want to say, your nose to your lower chest. So you're going to have your runny nose, your sneezing, your coughing, your sore throat. But then the flu is going to cause a much more full body picture. So fevers are more likely, chills are more likely, shaking chills are more likely. You can have really bad body aches and muscle pains. You're going to feel like you got run down. You're going to have a lot of those same respiratory symptoms we just mentioned. And then in some rare cases, you can have some GI symptoms like vomiting and diarrhea, but again, that's usually children. And then COVID can have the exact same thing. That unique change in loss of taste or smell is unique to it, but they can look very similar. So that's why testing comes in very handy. So most providers will do nasal swab tests. So there's rapid tests, and then there's the ones who take a little bit more time, like PCR. So the exact same thing for COVID. They can do a quick test, get an answer in 15-20 minutes at a CVS, at an urgent care. But if you go to the hospital, they may do a full PCR, or they can do both. The problem with this is that the rapid tests specifically, they're not very sensitive. They're not super sensitive. So in a lot of cases in flu season, if you have symptoms that match up with the flu, even if your test is negative, you may receive a diagnosis of the flu. And that's completely appropriate. Another bad thing about the flu is that there are no fully at-home flu tests currently. So now we have a ton of tests that we can use completely at home for COVID, but we don't have that for flu. You can find them online, but they're so expensive and you have to mail them into a pharmacy. So it's not like you're going to get an answer that same day. Honestly, it's way cheaper to just go into a CVS, schedule something, get a swab. You'll know an answer a lot faster and a lot cheaper. So hopefully that's something to come in the future. So what treatment is there for the flu? So most people really don't need much. You know, if you're young, if you're healthy, you're going to feel pretty run down. You should isolate at home to make sure you don't spread it. But really just rest, fluids should be enough. Now, if you're one of those higher risk categories that we talked about, older adults, children, pregnant women, anyone with any other major lung issue, heart issue, or immune system issue, you are a good candidate for antivirals. The earlier, the better, which is why testing comes in. So you can talk to your doctor, you can talk to an urgent care or an ED about getting antivirals if you have severe disease, if you're at risk for severe disease, or really, honestly, if you just want them. So again, treatment should be early, ideally 1 to 2 days. And what they can do is they can make symptoms a lot less severe and they can shorten it. So instead of being sick for 7 days, maybe you might be sick for 4 to 5. And that doesn't sound like much, but when you're in the trenches with the flu, a day or two of feeling better really does make a difference, especially if you have to take care of children, get back to work, take care of parents, all that stuff. It can also decrease risk of some complications like pneumonia. So that's another reason. So let's say I get the flu. I talk to my doctor about treatment. He puts me on treatment. So what should I do? Should I stay at home the same time as COVID? Should I not? So it's a little bit less strict with COVID. I'm sorry, with flu compared to COVID. So you should stay at home at least until your fever is gone, plus 24 hours. So if you stop being febrile on a Tuesday, then you should really stay home until that Wednesday evening after 24 hours. Without Tylenol. If you're taking Tylenol around the clock, well, that's going to artificially decrease your fever, which is fine, you know, if it helps your symptoms. Fever isn't necessarily a bad thing unless it makes you uncomfortable or it's dangerously high. Fever is your body fighting the infection. But if you're taking fever because it's very high or you have a lot of pain, make sure that your fever is gone off of Tylenol. And then do the usual things at home. Clean, disinfect your hands and surfaces, cover your cough. You can consider masks if you're around others, the usual things we've done for COVID. So should I get antibiotics for the flu? No, 100% no. This is a really common reason that antibiotics are overprescribed. So a lot of times patients will come in and they'll hear that their friend got a Z-Pak and they felt better and I need some azithromycin. So antibiotics do not treat the flu. On the contrary, they don't treat any viruses. And what they do is they lead to antibiotic overprescription, bacteria resistance, antibiotic side effects, and there are plenty of antibiotic side effects. You can get diarrhea infections from them because they kill all your good gut bacteria and the bad one overruns it. They can cause issues with your bone marrow, kidneys, liver, you name it, rashes, all that stuff. So one of the challenges I think a lot of doctors have is that patients come in, they expect to get antibiotics. And if you have a busy clinic, you don't have time to explain to your patient viruses versus bacteria. Sometimes it's just easier to write the prescription, but really it's not necessary, and it leads to a lot of resistance to bacteria. And I won't get into that issue because that's a little out of scope, but the resistance we're seeing to a lot of our antibiotics is very, very concerning, and we are running out of antibiotics, especially things like azithromycin that are commonly given over the counter. If you have the flu, you don't need antibiotics, you need rest, and maybe you need some antivirals. So there are options. Now, there can be bacteria complications on top of the flu, but they're rare. They're rare. And they shouldn't happen the day you get flu. They should happen over time. Like I was getting better and then I got worse. Maybe you might have a pneumonia. I was getting better and then I didn't get better and it's been 7 days and I'm still feeling terrible. 100% get yourself checked out. But if you just develop symptoms of the flu, antibiotics aren't going to help you with that. So another question is, why does the flu change every year? Why do we have new vaccines every year? Why can't we pin this thing down? So the flu virus, similar to many other viruses, it mutates and it changes. So there's a couple different types like we mentioned. A, B, and C. Type A and B are the ones that cause seasonal flu. and type A is the one that's most diverse. So you've probably heard of flu, H1N1, H3N2. So those names that the virus gets are because of the proteins on the surface. So here you have H, and then here you have the N. So those are proteins on the surface that give it a lot of their properties, how infectious they are, how they behave, etc. So there's 18 types of the H protein and 11 of the N. So that can make a lot of combinations. So the flu loves to mix and match. It likes to change those proteins. It likes to share those proteins. It likes to mix them up. And that's why the flu constantly changes, because it continues to mutate over and over every year, and sometimes even throughout the same year. So there's two main ways viruses, specifically the influenza virus, change. So they teach us in genetics about antigenic drift and shift. Drift is when the virus slowly changes its proteins on its surface. So it kind of lets you know which direction it's going. And shift is when it makes a left turn and you are out in the cold because you have no idea what it did, and it just jumbled things around. So it's hard to pinpoint sometimes when it does that, because you thought it was going one way and it changes completely. Or even if it was gradually changing, there's still significant changes that are hard to keep up with. So that's why the flu changes every year, sometime within the same flu season. So I think a good way to understand what goes into the flu vaccine is to start with the whole process. So the flu vaccine is made way before the flu season starts because it takes so long to make vaccines, as we know, right? So with COVID, we've been able to make the vaccines at the same time the same time those variants exist. And why is that? Because those variants stick around for a while. We dealt with Delta for a while, we dealt with Omicron for a while, to the point where we had time to go back to the lab, figure out what Omicron was, make a vaccine, distribute it, and there was still Omicron on the streets. The flu isn't like that. The flu changes much more rapidly. So if we were to wait until the flu season started to go to the lab, to make the flu vaccine, to bring it out to the streets, it would be done. The flu would be different and it would be gone. The season would be over. So what happens every single year, twice a year, is that all the national influenza centers, they collect data about what strains they're seeing, what viruses are circulating, how they behave. They feed all that information back into World Health Organizations and other groups that work with them. They review all that data, and then they select which strains they're going to put into the next vaccine. So this is not, if we had a crystal ball, we could pinpoint it and that would be amazing. But what we're doing is making educated guesses based on data and science and analytics. So that means a lot of what we're doing is hoping the virus doesn't change fast enough and we get it right. So this happens twice a year. There's a different flu vaccine for the Northern Hemisphere and the Southern Hemisphere. So if you travel, it's something to know. If you go, say, to Europe, you may have, a different flu vaccine, and you may have a different flu season. So that's something to be aware of. So they're usually trivalent or quadrivalent. What does that mean? That means there's 3 or 4 strains. So this year, I believe all the flu vaccines are quadrivalent, which means there are 4 strains that they picked. And the goal is to see if anyone is infected, we're going to get at least one of those 4 strains. We're going to get them protection through the flu. Now, you shouldn't be getting all 4 strains at once. You're going to get one. Hopefully, it's one of those 4. So once those virus strains are selected, then they have to be grown. So they are usually grown inside eggs, and that's where the egg issue comes from. So they're usually grown inside eggs because they need an environment where there's a lot of nutrients, where they're rich, where they can combine together and grow together. And sometimes now we also have cell cultures that are egg-free. So a lot of the issues with vaccines are people like, oh, I'm allergic to eggs, can I take it? Honestly, even if you're egg intolerant, unless you have a severe life-threatening reaction, you'll do just fine with this vaccine. But if you do have a severe reaction, there are options that are free of egg. So once those eggs have the viruses that have grown sufficiently, all the viruses extracted, then it's killed or weakened to make the vaccine. So it's not infectious. And then it goes through its quality testing, sterility, and then it goes through FDA, and then it gets rolled out at the start of the flu season. So it's a long process. So again, it starts early to make sure we have enough vaccines for the flu season, but that's kind of a double-edged sword because it allows us time to get everything going, but it also allows the virus time to change. So there can be a chance that as soon as we get the vaccine out, there's been some changes, or there's been some new strains that are circulating. And of course, there could be also strains that we weren't expecting to circulate. It could be circulating. So there's a few different vaccines available. So we talked about the one that's non-egg based for anyone who has severe issues. There's also variations of the vaccine that have higher doses for older people. So our immune systems get weak as we get older. So with higher doses or higher ability to activate the immune system, we're hoping to give older people more protection because they're at risk. And then there's also an intranasal vaccine that sometimes is given to military recruits. Can I get the flu from the vaccine? No, you cannot get the flu from the vaccine. The vaccine is dead. I'm sorry, the virus in the vaccine is either completely dead or completely weakened. The only caveat is the intranasal one is very weak. So it will not infect you. But if you have someone around you that is very, very immunocompromised, we don't recommend you get that vaccine because those weak particles could affect someone with a very weak immune system, especially if they're not vaccinated and protected. But aside from that, then no. And then people often say, well, I have aches and pains after the flu. Does that mean I got the flu? No, that means your immune system is working. I mean, don't get me wrong, there's a chance that you could have been already brewing the flu by the time you got the vaccine. So those two things can kind of confuse each other. But in the majority of cases, that just means your immune system's working. It's creating those antibodies. It's creating those soldiers you need to fight the flu when it actually comes your way. And I think we know this really well from the COVID vaccine, who has caused, in my opinion, or from my experience, a lot more severe weakness and chills after the vaccine. So that's your immune system responding. That's a good thing. So how effective is the vaccine? So sometimes it's great. Sometimes we predict the right strains. It doesn't mutate by the time we get it out. And we have wonderful success rates. And sometimes it's terrible. It's not good at all, but we did our best. And even if it's not great, we gave some people some amount of protection. So you can see a range of efficacy over the last few years. And so in some years we do amazing. We do 56%, 60%, 49%, that's great. 2014 wasn't that great, around 20%, but a lot of these other years, so. And then now I think it's really murky just because we have so many things with COVID and some mask use and things like that. The way viruses have behaved has changed a little bit. So someone may look at this graph and be like, well, this is just terrible. I mean, if a vaccine isn't 100% effective or even close to 90% effective, why should I even bother? Well, let's think about this process. If someone put you in a room with a dartboard and you had a general idea where the dartboard was, but you didn't really know where it was and you were blindfolded, and someone said, I need you to hit the targets and I need you to hit it as many times as you can, and you get that target 5 or 6 times out of 10, that's amazing. And that's what these numbers show. We hit the target 5 out of 6 times, 6 out of 6 times, 4, 5, so on and so forth. That's pretty good. And another thing to remember is that even a vaccine that is only 50% effective sometimes, if it can lower the cases by 50%, that is still tons of deaths that we prevent, tons of hospitalizations that we prevent, tons of infectious complications from the flu that we prevent, and so on and so on and so forth. So how effective it is does vary season to season, depending on how well the vaccine matches with what spreads. And this speaks to what we talked about, the 2019 to 2020 flu season. And let's go back to look at how efficacious it was. So it was only 39% effective. So let's say 40. So a vaccine that was only 40% effective, it prevented 7.5 million cases, close to 4 million medical visits related to the flu, close to or over 100,000 hospitalizations with the flu. And let me tell you, as someone who sees hospitalized patients a lot, you go in with the flu, a lot of other things can happen. So preventing even one hospitalization in someone is a big deal. And over 6,000 influenza-associated deaths from a vaccine that was just around 39% effective. So in the grand scheme of things, that's huge. And another thing to think about is always herd immunity. Remember, if others around you are protected, even by 50%, that spreads how protected the population is. Even if a vaccine isn't great, if more people have even some protection, it becomes even better for everyone. It's even more effective. Everyone is more protected because now a lot of people around you are not susceptible, which means you are not susceptible. So that means that you're, someone who has a bad immune system and is not going to respond to the flu, like they have a transplant and they can't create antibodies. Or maybe, your pregnant neighbor who's too scared to get the flu vaccine doesn't get it. You're still going to be protecting those people by having the vaccine and being around them. So of note, it does take around 2 weeks for your body after getting vaccinated to make enough protective antibodies. So you're still susceptible during that period, even if the vaccine is a great match. So what if you get the flu after you got the flu shot? Well, why did I get the flu? I got my flu shot. Well, first of all, we know it's not perfect. We know we're trying the best we can to match those flu strains. So there is a chance you could get a different strain that wasn't covered, or that strain just mutated before we got a chance to get that flu vaccine out. Also, I think I see the most this top bullet, the timing of exposure. So I've had multiple patients say, well, I got the flu vaccine and then I got the flu 3 days later or 4 days later. So either the flu shot doesn't work at all, or the flu vaccine gave me the flu. So we know the flu doesn't give anybody the actual virus. And what's more important is that flu vaccine was not protective at all. It's not going to be protective until you are at least 2 weeks out. So if you got the flu between that period, the vaccine had not kicked in yet. It wasn't going to give you any protection yet. So it's very likely that you were infected around the time you were vaccinated or exposed to someone who had the flu. You got infected, and then the vaccine eventually will kick in, but it just couldn't protect you in time. So when you were exposed around the vaccine, that's a big thing. Strains we talked about. Immune system. If your immune system is very weak, or you have something, a deficiency in your immune system, maybe you just didn't respond to the vaccine like maybe we would have liked. And then is it the flu? There's a lot of other things that can look like the flu, for example, COVID. And there's lots of other respiratory viruses we don't even test for because they're just so routine, so common. We don't go hunting for them unless you're in the hospital. So what if it's not the flu? So even if all that fails and you did happen to get the flu just because it didn't protect you enough for any reason, similar to COVID, studies show that your symptoms are much milder if you get the vaccine compared to if you didn't. So who should get the vaccine? So everybody should get the vaccine if you were 6 months or older. Infants less than 6 months cannot get the vaccine, but if you're pregnant and you get vaccinated with the flu, you give your child antibodies for up to 6 months. So someone who's pregnant will provide indirect or passive immunity to their infant for 6 months, afterwards they can get the flu. And then again, definitely those groups we talked about already that are high risk. So anyone who is a child, especially an infant under 2, is high risk for severe disease. Adults who are 65 and older, chronic illnesses, weakened immune system, if you're living in community settings like a nursing home, and then again, pregnant patients. So if I'm perfectly healthy, if I, barely get sick, or when I get the flu, it's very mild, why should I get the flu? Why should I bother risking, getting a shot and having my arm be sore and having to take time off from work to get the flu and risking, having a bad reaction? Why should I do that? Well, again, we talked about herd immunity. Even a vaccine that's not great, the more people get it, the much better it is. You're going to be protecting yourself, sure, but even if that's not your concern, you're going to be protecting your neighbors, your parents, children, your coworkers, the person on the bus next to you, the bus driver, so on and so forth. And then even if you were to have a mild case, that doesn't mean that others are going to have a mild case. It depends on your entire immune system and how your body deals with the infection. And we've seen with COVID how one person, it just branches off like wildfire. One person who feels relatively well, but it's infectious, they can spread that to everyone. What are the chances that every single person on that pyramid has a mild infection? It's pretty statistically unlikely. So, should I get a flu shot if I already got the flu? Yes, you still should. And why? Because remember, there's a bunch of flu strains that are circulating. You can absolutely get the flu more than once in a flu season, which is very awful. Imagine you get a terrible flu and then you get another strain a few months later or a few weeks later. That's awful. Sometimes they can provide protection against each other. If you get one strain, maybe it can provide some protection against another. They're very similar, but that's not always the case. The virus vaccine has 4 strains. So you can get infected with one, but the chances that you could get infected with another one could be one that's protected or gives protection with the vaccine. So yes, I recommend getting it once you're recovered from those acute illness symptoms, because there's a chance it could protect you from any one of those other four. Okay, so when should I get the flu shot? Already is the right answer. So the flu season starts as early as October and it goes all the way through May. So you can see our peak active months of the flu. So starts in October, numbers rise now in December, but they can go up until, look how high February is, and then it still goes into spring. So those are our peak months, but, sorry, I'm over here. So these are our peak months. But the flu season is from October all the way to May, and I've seen cases very early, very, very late in spring. So it's not too late, even if you don't get it for whatever reason until, March, April. I still recommend getting it. But the sooner, the better, because it can provide you protection throughout the entire season. Can I get the vaccine if I'm sick? So a lot of people are very nervous about this, but yes, you can. There's no reason you shouldn't get it if you feel a tiny bit under the weather. Now, if you have COVID or you just got diagnosed with the flu, I wouldn't run to get the vaccine because you want to isolate at home. You don't want to get, anybody sick on your way to get the vaccine. And it's fine to wait until symptoms are better. If you're still having fever, you don't have to get it that same day. You can wait until you're a little bit better, but you don't have to wait weeks. You don't have to wait months. Usually when I've been sick with kind of a wimpy cold or something else and I want to get my vaccines, I wait till my fever subsides. I feel a little bit better and then I get it. So you don't have to wait. There's no danger. Can I get my COVID vaccine and my flu vaccine together? Yes, you can get both of those together. They act on different parts of the immune system. They're pumping antibodies out of your immune system for different things. They don't interact with each other. They don't cancel each other out. It's perfectly safe to get both at the same time. There's even a CDC study that shows that it's safe, though yes, you might be a little bit more likely if you get both together to feel a little bit worse, but it's mild, it's short-lived. And this year I didn't get them together because they weren't available. Last year I did, and I felt not so great for one afternoon, and then I got it out of the way. So I wouldn't delay getting either vaccine because of fear of getting them together. It's perfectly safe. But even if you do want to get them separately for any reason, let's say you just don't want to feel bad at the same time for both of them, you don't have to wait a series of weeks or months or anything like that. You can get one today and then another one in a day or two. You don't have to wait. And then when should you ask your doctor about getting the flu vaccine? So there's only a few cases where the flu vaccine is either very cautiously given or not recommended. So that's usually in cases of someone who has a severe life-threatening allergic reaction to the flu, and that's perfectly understandable. But those are the people that really need to be protected by their neighbors and friends and family. So in those cases, it's very reasonable to talk to your doctor and making a decision based on your case if you should get the flu vaccine that season. Anyone with a history of Guillain-Barré syndrome, this is a syndrome in which your body can affect your nerves and cause weakness. So if you have a history of this or you've had an issue with this related to past vaccines, definitely talk to your doctor. But again, this is very rare. Again, most people with allergies, they do fine. They do fine with the flu vaccine. There are egg allergies, but there's also egg-free options if you are nervous about that. So that's also a possibility. And I believe that's all I have for you guys today. References, all this information is available on the CDC websites, the New York State Department of Health, the National Institutes of Health, and then the World Health Organization. The CDC has a really great page about influenza for both professionals and then both the community. So if you're interested in that, you can Google CDC, influenza, and it has a lot of commonly asked questions and things like that. All right, and if anybody has any questions, I'm happy to answer them.
Thank you so much, Dr. Torres. That was a great presentation, very informative. And I see Larry has his hand raised, so go ahead and ask your question, Larry.
Yeah, you'd mentioned this, and I have seen references to this new hybrid of RSV and flu. I've just seen one or two notices. Have you seen anything about it, or simply it is possible, it's in the lab notebook somewhere, but it's not clinically relevant, at least not yet?
You know, I've heard of a lot of co-infections. I don't personally know of any cases of the viruses combining, or if they're mutually compatible enough to kind of swap their proteins on their surface like that. If we do
I
see this,
believe I saw one in the literature, but I've
okay.
only seen one, and I've seen more about the Loch Ness Monster.
If it happens, I suspect it's probably happening in pediatrics, which I don't
Yeah.
treat. But I have had a lot of pediatrician colleagues describe how significant they're seeing the flu is, to the point where we were talking about, why do we have to test people for other viruses if they test positive for the flu? And they explained to us because they're seeing so much respiratory syncytial virus, which is RSV, and the flu, that they can never kind of chalk symptoms up to one or the other. But if they're combining, I wish, I'm going to have to read more about that. But I haven't heard of it happening in a person, but I definitely would like to.
As I said, Loch Ness Monster.
Yeah.
Also, by the way, I sent you a chat privately. Can you talk about the mechanism that connects Guillain-Barré to flu?
Yes. So Guillain-Barré is an autoimmune condition where basically your body creates antibodies that attack the encasing over your nerves. In very rare instances, so this can happen with a few types of infections. This can happen with sometimes gastrointestinal infections, diarrhea infections, respiratory infections. But there is a very small incidence where it can be connected to certain vaccines, including the flu. It's very rare. I don't remember the top of my head the number, but gosh, I'd have to say it's less than
Oh,
1%.
it connects to the vaccine?
Yes. So, it's mostly connected to actual virus infections. So respiratory viruses, gastrointestinal, it's most often a short-lived or neurological syndrome where you do develop some weakness, and sometimes in some it's pretty mild, in some others it's a little bit more intense and they need hospitalization. But in rare cases, it can be linked to the vaccine. Again, it's extremely, extremely rare.
It's sort of an opportunistic pirate.
What's that?
It's sort of an opportunistic and a pirate who sort of gloms on at the last minute, but it's not really related. Okay, thanks.
Yeah, so it's very rare. So if you have a history of Guillain-Barré already, then that's something you should just consider before getting the vaccine and talking to your doctor. But again, it's extremely, extremely rare.
Thank you. I see another question in the chat from Jeff. He said a lot of primary care doctors are still asking patients with COVID symptoms to stay home. How would someone find out within 48 hours if they have the flu if providers don't want to see them?
Yeah, that's a good question. I think that not having flu tests at home is just such an inconvenience. But again, our efforts were dedicated to COVID because of how much more severe it was and how it was a pandemic. We've lived with the flu for our entire human history, essentially. So, or as far back as our medical history. So there's been a lot of things that we've just gotten used to, not having at home. I think that, again, flu tests aren't perfect. So a lot of times if you're having symptoms that sound like COVID, and you call your doctor, whether it's a telehealth visit or this or that, and you had flu exposure, they can always diagnose you. If someone says, I have all these symptoms, I was exposed to someone with the flu, I think I probably have the flu, they can give you antivirals, they can prescribe those, you can have those delivered. And if testing is recommended, you can always go safely. The only times we say, it's fine to leave your house is if you're getting medical care. If you have to go see a doctor because you feel so terrible, if you need answers or medications, I think it's reasonable to, wear your mask really well, try to make a beeline straight for the place you're going to get tested at, whether it's an urgent care around the corner or a CVS, they can test you there for COVID and the flu. So maybe a doctor's office may not invite you in to come in, but there's lots of places that can do testing that are quick ins and outs to get you answers. And then you can follow up with someone over the results. But again, if there's a high suspicion for something like the flu, they can diagnose it based on your symptoms. And the antiviral is pretty well tolerated. So I'm not really worried if they give that to you based on your symptoms. But it's hard to tease out. So again, if testing is recommended. For example, if you had COVID a few months ago and you're still kind of in that window of protection, but now you have symptoms and it sounds like the flu, they can diagnose it based on your symptoms, but you can always check into an urgent care or a CVS pharmacy or something like that to get tested.
Thank you so much. I see another question. Can you get the flu vaccine and COVID booster at the same time?
You can. Yeah, so the vaccines don't interact with each other. They don't cancel each other out. It's perfectly fine to get both COVID, both the flu at the same time. Lots of people do. There's a small chance you may feel a tiny bit weaker, a little bit more malaise, a little bit more body aches, but that's mild, it's short-lived. Some people prefer to separate it. So if they feel sick from one, they have a chance to recover before feeling sick from the other. But lots of people get it together because they just want to get it over with, one and done, and that's perfectly fine. There's no time period where you have to separate them by an X amount of days or an X amount of weeks. You can get them as close together as you want.
Thank you. Do we have any other questions? Feel free to write in the chat or raise your hand or speak aloud, whatever is easiest. I saw Bernard, did you raise your hand? I think you're muted though. Okay, not sure if that was a question or not, but if so, then feel free to unmute yourself. Any other questions in the meantime? Okay. If not, I guess we can end a little bit early for today. Anything last minute, feel free to write in the chat, but thank you all for being here. And I hope you all have an amazing holiday and great rest of your day today.